All righty. So welcome, everybody. Welcome to the December 23rd Allume Town Hall. It's my pleasure to be with you. I hope you are getting into the spirit of things. It's kind of a crazy year. I mean, 2020, how about that? It's just been, you know, as I've been spending some time myself reflecting on the past 12 months, you know, it's extraordinary what we've all been through. What I've been trying to focus on, because it's important to stay positive, is all the things that I feel so grateful for. And every single day, I have a ritual where I wake up in the morning and I bring into my heart all the things. First, I ask myself, what in my life makes me happy? And the things that make me happy are things like seeing both of my daughters' beautiful faces, hearing their laughter, right? This morning I was describing it, just getting to wake up in the morning, drink a cup of coffee, and have him near me now, because usually he's traveling, right? The new normal now is he's not traveling, he's home. So those kinds of moments, getting to go for walks with my girlfriends, these are the things that make me happy. So I invite you, as you sit here right now, to think about what are the things in your life that make you happy? You know, is it a particular kind of chocolate you love? Is it the sound of a particular person's laughter, or a memory that when you think about it, it tickles your heart? It's important to start your day, I think, thinking about what it is that makes you happy, because that can influence you to focus on the things that make you happy, and then have more of those things, right? And then the second thing I always ask myself, which is a similar question, but it can be a little different, is, you know, what am I really grateful for? And when I think about what I'm grateful for, of course, I always think of my family. I think of my, you know, tremendous, you know, given, you know, opportunities and talents and everything that you know, life, a heart that beats. I think about a home where I turn on the electricity, I switch a light and the electricity generally comes on. I think about how lucky we are that we live in a world where you can turn on a little knob and water comes out, and it's clean water. And it's important to think about these things. And I always think about the people here at Allume. I always hold Marie in my heart, and I always hold Kyle and Libby and Christine and Taylor and Julio and Kelly and Fernando and everybody on the field. I think about all these people, and I think about, oh gosh, today I know Kelly with an IE's out there doing 3 recerts. Or I think, oh gosh, it's a billing day, and I know Jennifer Coleman's doing everything she can to push things over the line, get things finished so that we can bill. Or I'm thinking about Marie and how many performance appraisals that she's done in the past couple of weeks trying to catch us up. Or I think of Jen Williams and all the people that she's bringing into the organization every single week. And right now she's doing competency evals for everybody. And then I think about all the patients. I think about, oh my goodness, we have 130 patients, maybe more than that now. I'm not sure what the numbers are at this particular moment. I know that Marie brought in 5 new patients yesterday, skilled patients. And I think about how fortunate we are that they've come to us. And I think about how they've entrusted us in their care, and their families have entrusted us in their care. And it just moves me, you know, it makes me feel really grateful. And I think about how all of you go into the world every day, especially during a pandemic, and you put on your mask, and you put on your gloves, and you put on your gowns, and you put on your eye shields, and you walk into people's homes, and you're vulnerable, and you do it anyway. and you go in and you do the right things and you care for people and you go back out into the world and you try your best to keep yourself safe so that your patients and your family can be safe. And I think about, the other thing that I think about is how much, how great all of you are, really. Sometimes it happens that I only hear the negative stuff, right? It's like that. You hear only the things that are going wrong. But one of the things that's been a real treat over the last month is I've been working closely with Taylor and Marie, and we've been going through and trying to help catch up on some performance appraisals. And I'm moved. I'm absolutely moved at the feedback, what I hear from the field. Oh my God, this is a wonderful nurse, and this is a wonderful nurse, and this home health aide goes the extra distance. And it just absolutely moves me that we have so many wonderful, wonderful people here, and I just feel a sense of real gratitude. So I hope that, you know, as we move into this for some of you who celebrate Christmas or maybe Kwanzaa or Hanukkah or whatever it is that you celebrate, you know, it's unusual this year. We're not probably going to be able to gather with all the people we normally would. And you probably haven't had as many Christmas parties this year, right? Probably haven't had any. Or maybe they're all on Zoom, and that is nice, but it's artificial on some level. And so it's easy to kind of get ourselves focused on what's not right or what isn't enough or what isn't the way we want it. And I hope that you'll take this time to really cultivate feelings of hope and prosperity and goodness for what's there and for who you are, and really pat yourself on the back for getting through the year. And, you know, all the things you did right, all the things you did with love, all the things you did that was self-sacrificing, because I know everybody here did. And that's what Allumes are all about to me. That's what it means to be remarkable. It's about getting up every day and trying to do the right thing. It's about connecting with people in a way that's heartfelt and honest and genuine, and that moves people to feel better in the moment. And sometimes it's just a little better, sometimes it's a lot better, but we're here to try to do the very best we can. And so, you know, we have coming out to all of you over the next few days, probably into early next week, you'll start to get some packages at your patient site. You'll receive a little something from Allume. And I hope you'll enjoy that little treat that's on its way. If it doesn't make it there tomorrow, it'll come early next week. But it's a little something from my heart to yours to express how much I appreciate you and how much I really see each of you as you know, you're doing God's work. And in my heart, you are truly remarkable. So with all that, I'm going to go ahead and move us into to our topics today. We have a lot to cover in terms of content, so I'm going to move quick, but if you have questions, I hope you'll write them down and feel free to interrupt me if you have questions. So here we go. As you know, our intention during this time, as always, is to make a huge, powerful, positive difference to our families and our communities and to each other. And really, I believe that moments like this past year are why we exist. We are here to serve. And it's through our service that we can lead. And it's our opportunity to be remarkable. So our current status, so metrics as of the 21st, positivity rate per 100,000 people is, or sorry, 10,000 people is 5.18% since Friday. There's a net reduction in hospitalizations of 24, 95 fatalities. There was in fact a surge from Thanksgiving all around the country. There was a small surge in Connecticut. Vaccines, there have so far as of the 21st been 7,761 doses administered so far. I know there are some of you who've been vaccinated so far, some of you working in a healthcare, in a hospital or in a skilled nursing facility may have already been vaccinated, have received your first vaccine. Moderna vaccine is beginning, is approved and is starting to be distributed around Connecticut, 34 hospital locations, 21 FQHCs, and 21 local health departments. We believe that the Torrington Health Department, which is we've been partnering with, I'll tell you more about that in a minute, they're supposed to get their shipment today. So over the next month or so, 6 weeks, Group 1A will be vaccinated. That includes healthcare workers and residents of assisted living. We'll talk more about the 1A in a second. 1B will happen after that, and that's going to be first responders, teachers, school staff, childcare employees, corrections officers, public transit people, postal workers, grocery staff, manufacturing. And it also includes all adults aged 75 or older. So previously they had said it would be 65, they've changed it to 75 and older. And so we've already started receiving those vaccines. They're expected to get about 200,000 vaccines in the state of Connecticut, shipped here, not delivered, but shipped to Connecticut by the end of this year, by the end of January. So there's a lot coming in, but it takes time to distribute and to get them out. 1C will happen after 1B, and those are other essential workers, including adults aged 65 to 74 and younger people with underlying conditions. So that would probably include a lot of our patients who are children. And so it says there's lots happening right now. There's lots of distribution happening. And so, you will be getting more information about how you can get vaccinated if you haven't already from another employer. So so this is a deeper look at the 1A group. So first responders, some first responders are eligible. So those who respond to medical 911 calls are eligible right now in the 1A. School nurses are also eligible right now. Home health providers, of course, and homemaker companions, those are all, of course, that's us. Dentists are included in 1A. Students doing clinical, various types of students doing clinical rotations are also on the list. And everyone who works for a healthcare organization. So they talk about this 1A, it's that not everyone in a healthcare organization is eligible, only those who are actively working in healthcare settings and employees of healthcare organizations who are teleworking or conducting exclusively telehealth are not eligible. So that's just something to be aware of. The distribution, as Dotis was split it equally between healthcare facilities, including hospitals. So that was earlier in the month, those came in and how they were distributing them. There's a whole process of us getting set up to receive the vaccines and get you signed up if so that you can register to get vaccinated as well. We've been going through that process. I'll say more about that in a minute on the next slide. But there are lots of places where the vaccine clinics are happening. So there's certain health centers like hospitals, local health departments like the Torrington Health Department that we're involved in, along with CVS and Walgreens and other healthcare systems. There's a lot of different places that are going to be distributing vaccine. So as I mentioned before, we are affiliated with the Torrington Health Department. We have about 5 nurses who have signed up to deliver the vaccine through the Torrington Health Department as an Allume employee. So we thank those nurses who signed up to do that. You, as you know, take a test, or rather a class. It's an online class to do it. And then by doing that online class, then you get certified and then you can be part of the distribution. So the Torrington Health Department is expected to receive their first shipment of the Moderna vaccine today, the 23rd. And then the first clinics will take time. They expected it won't go super fast because they're using a new electronic medical record system. And there's a lot of information they need to collect. And also, from what I understand, you kind of arrive, you put your information in, you get your vaccination, and then you need to wait 20 or 30 minutes before you leave because they want to make sure that there's no reactions, any kind of. So they're starting to starting to get ready for some clinics as soon as this Saturday. And so here are their first we're planning to do, and then weekly ongoing, and they don't have specific. Our team of nurses won't do the first few groups of vaccines. They will, the Torrington Health Department's going to do that themselves, but start to staff some of those vaccine clinics, which I think is really exciting. And you know, it was when we were invited to do it, asked if we would do it, we were really excited, Maria and I, to say yes, because we felt like it was a great way for Allume to support the community. We also are signed up. Marie got us all signed up through the VAM system. Please don't ask me what VAM stands for. Vaccine Administration Management System, maybe. So anyway, it's an online portal that we've signed up through, and it's also through the CDC. Everyone, so they've asked us to upload our rosters, and so due to scarce supply, they've asked us to upload rosters in 3 waves. First is the high risk, first phase 1A. So people who are out in the field, which is all of our field staff, those who are exposed to COVID patients or infectious materials, or could suspected, you know, people who with COVID-19. Also those who work in enclosed places with individuals who don't wear a mask. And we have a lot of patients in that category, right, where your patients cannot wear a mask. So, so most of our field staff would be in that group. The medium, we really don't have any that I would call as a medium risk. I don't think. You know, it's most of you are, if you're out in the field, you're kind of in that high risk. Low risk would be those who have less direct exposure. So those who are working in the office and interacting perhaps with the case managers or other field staff. It could be others who go out to the home to deliver things, that kind of thing. So there's that group. So that's what 1A is, and they're asking us to sort of create groups according to this level of risk. And then they will start to make appointment availability. So it will take time for everyone to get scheduled. And I think what will happen is you will, you'll self-schedule. Telecommuters are not eligible. So if you're someone who works for Allume, but you don't come into the office, you are not eligible for the vaccine in phase 1A at this time. So that's exciting stuff. Will the vaccine be required? I'm not sure yet. We're not sure. We're watching guidance. Some healthcare companies are making it required. Others are not. Allume is not sure yet. Allume is on the fence. I will tell you that we strongly recommend it and hope that you do get vaccinated who qualifies. Again, if you please place yourself on mute. I can hear some people in the background. Unless you have a question. COVID sick pay will no longer, it's going to stop in March for 2 reasons. One, the government is going to stop covering it then. And also it's, if you have the opportunity to get vaccinated, but you choose not to, choice, but you won't at that time be qualified any longer for COVID sick pay. So, so just something to bear in mind. We won't, you know, we may not require it. We will strongly recommend it, and we will discontinue the COVID sick pay as soon as people have it available to get vaccinated. So just something to be thinking about. Next is, yep, there we go. Travel advisory continues. At this point, I was just on it earlier today, and it looks like pretty much everywhere is on the travel advisory except for New York, New Jersey, and Rhode Island. Everywhere else is considered not safe to travel, and you're directed to do self-quarantine for a 10-day period. And when you return, you must fill out this travel form and indicate where you've been. There's more information, which I can email out to everybody with the specific guidance from December 18th on mandatory self-quarantining, as well as travel advisory information. So you can opt to take a test, a COVID test, instead of quarantine. So what they really want you to do is have the PCR test and not the rapid test or the or an antigen test. It's got to be the PCR test in order for it to qualify. And just in general, we're asking people not to travel, except for to New York, New Jersey, Rhode Island. Please don't travel so that we don't have situations where you can't work because you've traveled. So at any time you can go to the Connecticut State Gov portal, ct.gov website, and see the list of places that are on the travel advisory. It gets updated all the time. And certainly keep an eye on it if you are planning to do any kind of travel. So this map was pretty unbelievable to see, because in past months when we've looked at it, it's been really nice and spotty. Now it's really not spotty, it's totally filled in. So we have a lot of COVID going on right now. And it's not all that surprising, but it is something we should be very, very mindful of, especially going into the holidays and so forth. I mean, huge difference between last month and this month, the amount of red that's on here. So 15 or more cases per 100,000. As of December 21st, there have been 158,000 laboratory confirmed cases, 10,000 more probable cases, 1,158 are hospitalized, and we've had 5,703 COVID associated deaths. So that's where we are right now. So return to work guidance. So that's also been updating pretty regularly. And so healthcare workers who develop symptoms suggestive of COVID should be tested as soon as possible. So we want you to do that. And as soon as you feel like you have any symptoms, you need to reach out to us and fill out a form. We're going to walk through that form, the employee incident form. If you should have any moments where you start to feel that you have any symptoms, or if you have any exposures, you need to fill out that form so that we can assess what next steps are appropriate to do. So healthcare workers with suspected or confirmed COVID-19 should not return to work until, it says here, 24 hours have passed since recovery, defined as not having basically fever, improvement in symptoms, at least 10 days have passed since symptoms first appeared, and the healthcare worker, him or herself, is not immunocompromised in any way. So that's kind of the return to work guidance in general if somebody has COVID-19. So anyone who meets the criteria but continues to have mild symptoms can return to work, provided they adhere to respiratory hygiene and cough etiquette, and you perform your very frequent hand hygiene and wear a face mask, of course. And it says face mask here. I would say anybody in that boat needs to be wearing an N95. So that's the newest guidance on return to work for those healthcare workers who have suspected or confirmed COVID. So what if you're asymptomatic? So it says asymptomatic healthcare workers with unprotected exposures to COVID-19 should quarantine if possible. Quarantine should begin the last exposure to someone who is infected and last for 14 days. So healthcare workers who have an unprotected exposure to COVID-19, but who've tested positive, are but are still asymptomatic are not required to quarantine and may continue to work. If there are staffing shortages, which Allume is experiencing, we should refer to CDC's staffing mitigation guidance. So here's what we do in times like now, where we have staffing shortages. In the month of November, we had 29 incidents of people having some kind of exposure or situation where they needed to get tested, and it has dramatically affected our ability to serve our patients. So we really need everybody to be careful and cautious, fill out that, and just know that we're in a staffing shortage right now. So we want, workers who are exposed can return to work, provided they have the following for 14-day period monitored. You can actively monitor for signs of fever and symptoms, and take your temperature twice daily. You adhere to the cough etiquette and hand hygiene, and wear a face mask, N95 mask at all times. And decisions here are made on a case-by-case basis. So we're really focusing on making sure everybody stays safe, but we keep as many people working as we possibly can. So at all times, you should be wearing a gown, mask, gloves, and eye shield at every single visit. This is super important now. Remember, I'm just gonna pop back up right now. This is where we are. We're in the red zone, right? I don't know what town this is that's in the orange zone, but it's like, you know, this little town and this little town, and this little town. We're in the red zone, pretty much everybody. So we really need to have no fooling around when it comes to PPE. You need to have a gown, a mask, a gloves. If you have had some kind of an incident where you think you might have been exposed and you're sent back out to work because the exposure isn't a high level exposure, we're gonna walk through that in a minute, you should wear an N95. If you don't have an N95 already, if you right now do not have an N95, please reach out to your ambassador and figure out how to get one. You should have one at all times, especially now. So if you have an incident, then you can tighten up your PPE, so not just wear a regular surgical mask, wear an N95. We have plenty of N95s that have been given to us through the DPH, and you know, we're not in a shortage of them right now. So I'm not saying you should wear them, you know, 5 of them a visit, but we have them and you should use them. If a patient is COVID positive, wear a N95 mask, wear your eye protection, wear your gowns. Everyone has been given gowns. And so if you can reuse your gowns by keeping them in a paper bag with your name on it and store it in a safe area in the home. So you can reuse your gowns. Now is the time for you to be really focused on PPE to keep everybody safe and keep infections down. So COVID sick pay, as well as decision-making around return to work. So as I mentioned before, if you have a situation where you're exposed to someone who might be COVID positive or is COVID positive, or you are experiencing symptoms, but you don't know where you might have been exposed. Either way, you want to fill out the employee incident form. And I'm going to show you what that looks like. Let's see. So this is the COVID incident form, and it has a lot of information at the top for you to read, and I will go through it in a minute, but then it's going to ask you to give your email address, your name, your phone number. If you had an incident, what was the incident? Write it down. If there was a time or something that happened, what was the date of the incident? It's going to ask you, were you directly exposed within 6 feet for 15 minutes? So then you'll choose yes or no. You'll say, who was the person to which you were exposed? It was an Allume patient, a family member of an Allume patient, an Allume employee, a patient or family member from another job, someone living in your household, someone you don't know personally but were exposed to in the community, a friend or other. So you'll describe who the person was, And the reason why we're asking here is we're trying to get a sense of, oh, is there another Allume person patient or employee that we don't know about? We want to make sure that we know about every incident that's out there. And then for contract tracing, we need to know if you were where you might have been exposed to it. The next question here is, were you wearing a mask during the entire time you were exposed to this person? So you want to answer that question. It's very important. Which of the following were you wearing when you were exposed? So you're any of the above you want to include, or no PPE if you were exposed and there was no PPE. So it could be, you were with your child, right, who caught it somewhere. And so maybe you wouldn't be wearing PPE. Certainly, hopefully, if it's for a patient, plenty of these boxes are checked. Was it indoors or outdoors, right? It makes a difference whether it was the level of risk, of course, goes way up if it's indoors that your exposure was happening. And then what is your temperature right now? And then are you experiencing any symptoms? So any of these things. And then since the date of your exposure to a person confirmed or being tested for COVID, have you been in direct contact with any Allume patients or employees? So we want to know if, okay, you had an experience last Tuesday where you were with somebody who was COVID, then was discovered positive. We want to know if you have since then potentially affected anybody else who's an Allume patient or employee, so that we can take direct action around that. If you've been in direct contact with any Allume patients or employees, who were they and on what dates? You want to provide that. And also the question, have you been tested so far? If you were tested, what were the results? I did a rapid test and it was positive or negative, or I did a PCR test and it was positive or negative, or no, I haven't been tested. And when was the last, when did you last work at Allume? So when was your last shift? And when is your next scheduled shift? And then is there anything else that you would want to share with us about the incident or about the situation? And then you would sign it. So this form tries to help us understand the full situation so we can most efficiently determine what to do next. And so you're looking through up at the top here, think about, you've just answered all these questions. And the answers to these questions will be sent to the administrator, Marie, and she will make the decisions about what you need to do next as far as return to work, as well as whether you will qualify for Allume COVID sick pay. And so you'll see right here in the form is our sick pay policy. We can talk about that in a second. But there's basically, there's 4 different return to work decisions. And so it's all based on the return to work guidance that I just walked through a few minutes ago, the 1124 guidance. So she'll make a decision based on that. And she'll also look to see whether or not you can receive COVID sick pay. So you'll go ahead and you'll submit this. Once you submit this, then the next thing that will happen is Marie will get the form and she will make some decisions. And she will fill out a new form, COVID decision-making form. And she'll decide 3 things from it. She'll decide whether you can return to work or how, whether you're eligible for COVID-19 pay, and then any other communications that need to happen. So return to work, she's got, first option is return to work, option A, isolate for 10 days. This happens when somebody, an employee, has COVID-19 or is very suspicious of COVID-19. So this is someone who has been exhibiting 2 to 3 COVID symptoms or has a fever above 100.4, this is somebody who we think probably has it. And this person should isolate immediately and be tested if he or she hasn't already, and remain in isolation for a minimum of 10 days since the symptoms first appeared, and at least 24 hours since the last fever. And what we want to see an improvement of symptoms as well. So isolation for 10 days is the first option, and that's for somebody who has COVID. Return to work option B is a test and quarantine for 10 days. This is when an employee has been exposed to someone confirmed or being tested for COVID. So they've had exposure of direct exposure, and direct exposure is defined as being within 6 feet of someone for 15 minutes or more who has COVID. The exposure happened indoors. The employee was not wearing PPE when the direct exposure indoors occurred. And the employee is also developing symptoms. So they have 2 or 3 symptoms, or their fever is above 100.4, or they're experiencing specifically a loss of taste or smell. So if you just have a sore throat, we're not going to assume that you are COVID positive or symptomatic. If you have a couple of different things, shortness of breath and cough and a sore throat, okay, now you've got 2 or 3 symptoms that sound and look like COVID. Or you have a fever above 100.4, or you're experiencing that taste of or smell. That's a big indicator. So this was when we would have you return to work after 10 days and, some paperwork. So with this option, you're directed to go get tested, quarantine for 10 days, and then, proceed until you're ready to come back, and then produce the results of your test and so forth, that you're feeling better, etc. Return to work option C is with extra precautions. This is what we're doing under situations where there's staffing shortages. So this is when you've had a direct exposure indoors without PPE, but the employee is asymptomatic. So it's all the same things as return to work B, but you don't have any symptoms. So if you're without symptoms during a staff shortage time, which is now, you may be guided to return to work using PPE, in particular the 95 mask, and actively monitor your symptoms. Fill out the daily health screening form twice a day or twice per shift. Adhere to cough etiquette and hand hygiene, and wear a face mask at all times. So that's return to work C. Return to work D is where you take a test, you get a PCR test, and you return to work with PPE right away. This is, so if you're somebody who has traveled to a hot zone, so basically if you've left Connecticut, New York, New Jersey, Rhode Island, then you would need to follow that whole option and until you get a test, right? You have to quarantine until you've tested to return. Option E is your test and employee safe to go to work. This is when you have a COVID exposure and of some kind, and but you're not exhibiting the full symptoms, and you may or may not have been with them inside or direct exposure. So some part of that doesn't qualify for option B. So that's when you are directed to go ahead, get tested, but you're safe to return to work. You should be very careful with your PPE and use mask, gloves, eye protection, isolation gown, hand wash, etc. So those are the choices that Marie will select from, and she'll tell you which of the following to take. So that's the first decision. Second decision she makes is, are you eligible for COVID pay? Those are 2 separate decisions. Do you return to work? Do you have COVID pay? So we've sent out the COVID pay policy. We can resend it, certainly. But here's how the COVID pay works. Yes to COVID pay if the employee is tested and is confirmed COVID positive, the employee qualifies for COVID sick pay. So then it's how much COVID pay is a separate question. This is how do you qualify? You're COVID positive, the answer is yes, you qualify. Yes to COVID pay if the employee has has pronounced COVID symptoms, again, 2 to 3 symptoms, or a fever, or loss of taste and smell, the employee qualifies for COVID sick pay while he or she is getting tested. So let's say today you have some kind of you're having symptoms and you go get tested. You have 48 hours to get tested. So if it takes you 3 days instead of 2 days to get tested, you're not going to get paid for all 3. You're only going to get paid for the 2. And then you get tested, and while you wait for the results of the test, you continue to qualify for COVID pay. Then you get the test back. If it's negative, then you can return to work and COVID pay ends. If at that point you do not, if you're positive, then you're COVID positive, then it can continue on for up to 2 weeks. So that's the yes to COVID pay. No to COVID pay is if one of those yes situations does not, apply. So so you must be either positive for COVID, have pronounced COVID symptoms, and be getting tested, or have an exposure, not wearing PPE, be indoors, etc. So Marie will make those decisions about whether you qualify for COVID pay, yes or no. And, so yes, you're symptom positive, or sorry, yes, you're COVID positive, you qualify. Yes, you qualify because you're getting tested, or no, you do not qualify. You might be getting tested, but you're able to return to work, so therefore you don't qualify for sick pay. So all of this is part of our policy. Once she receives your form, then she fills out a form and she tracks which of the specific, was it directly exposed? How did she get it? And then she's going to make some decisions. She's going to come down here and there's going to be return to work decisions. She's going to specify which return to work decision it is. We talked about each of these: isolate for 10 days, test and quarantine for 10 days, test and return to work with extra precautions, PCR test and return to work, or test and employee safe to go to work. Another is return to business as usual. So she's going to make that decision. And then she's going to say, are you eligible for COVID pay? And it's either going to be yes or no. And then she's going to say, okay, what do we need to do in terms of communications? Who needs to be informed? Who's already being informed? She'll make those decisions, and then Allume will reach out to anybody who needs to be informed at that point. So all of that will come then to you. You'll get the decision form from Taylor. Taylor's going to take that decision form that Marie completed, and she's going to send it to you along with something for you to sign. It helps you understand what your process is for how to collect COVID pay if you are eligible or not. So those are some of the important pieces that I wanted to make sure to walk through it so everybody is aware of it. Super important that if you have a COVID incident or you are experiencing symptoms, that you be sure to reach out to the office and get access to this COVID incident form. That's the first thing. You will not get any, this is the first thing you have to do. There won't be COVID pay until you have done that. All right, so then returning here to this page. So we talked about the decisions that need to be made, return to work instructions, and COVID sick pay eligibility. And then Taylor will send you the decisions and any further instructions. The way that the COVID sick pay works, once you're eligible, you can receive up to 14 days of sick pay. And that breaks down to being maximum of 40 hours per week. And it's based on your scheduled shifts. So if you normally work Mondays, 3 to 11, and Fridays 3 to 11, and you're out Monday, Tuesday, Wednesday, then you would get COVID pay for that one shift, but you wouldn't get it for that Friday. It's only for those that you are scheduled for, that you are, have a permanent shift scheduled. If you have other types of, you're exempt of overtime. So if you worked a bunch of hours early in the week and the balance of the week puts you over 40 hours, you will not get COVID sick pay that extends beyond 40 hours in that week where you get paid for the 40 hours. That's also something you should know. And if you're signed up already for paid time off and then you get COVID, then you're already in PTO time. So those are just some things just to be aware of upfront of how the decision-making process works and how to use the sick pay. I think that's it. So moving on here, just as reminders, what are symptoms of COVID-19? Cough, shortness of breath, fever, chills, shaking with chills, muscle pain, headache, sore throat, and loss of taste or smell. Are COVID symptoms, so you want to watch for those. You want to be doing this daily screening now more than ever, okay? This is super important. So if you are asking these questions and people give you the response, then they're going to be more likely to let you know if there's issues. They're going to keep you safe. You're going to keep your family safe. And it's also just extremely important that we're asking these. They're expecting you to do that. It will appear that you're not following procedures if you're not. So be sure to ask the questions every time you go to the house. We talked about PPE already. I can't emphasize enough how important it is you have your PPE and make sure that if you have any COVID suspected or confirmed situations, that you're wearing an N95 mask. We have plenty of supplies for you, so you are able to collect a month's worth of supply at a time. Make sure you have the PPE that you need for the next month. Work with your care team to make sure you have it. So you can come to the office and pick it up. You can reach out to your ambassador and they'll package it up for you really nicely and make it ready for you. You might be able to convince your case manager to bring it out to you as well. There might be other people in the house too that are coming into the office to pick up PPE. And I would recommend if you're coming into the office to pick up PPE that you reach out to the other members of your care team at that same patient and ask them if they would like you to pick it up for them. That could be a nice way for you to help them out. Pick up PPE in the office, call ahead, protect yourself, your patient, your team, mask, gloves, eye protection, gown at all times. Okay, we talked about the travel ban. We're doing lots of virtual meetings. Even those of us who are in the office, we're meeting mostly by Zoom. Refrain from crowds, especially going to the malls and things like that right now. Avoid meeting with others indoors of any kind. Limit number of people you interact indoors other than those in your household. Maintain 6-foot social distancing, cleaning and disinfecting your work area every 4 hours. And notify Marie of any known exposures by filling out that form right as soon as you can. Every day, we're asking you to fill out the staff screening form. You get a text message, I know it's 7 a.m. So please fill that out. Be sure to wash your hands every 15 minutes while working. Clean and disinfect at least every 4 hours. Do the same thing in your own home, especially your high-touch services. We've communicated to families that we expect them to also participate in the forced screening questions so that you ask them every time you see them. You want to post that forced screening questions near the bed. So case managers, please make sure to bring out copies of the forced screening questions and put them up near the bed. Self-quarantine patient and all of those living in the home. Agree to 6-foot social distancing. We've asked the families to do that. If someone is in the home, and who is an essential worker, it's important to have additional masking and so forth with them. We want to make sure they don't have visitors indoors. Any visitors must be outside the home and maintain a 6-foot distance. And we ask that anybody who's in the space, a family member who's with a Allume team member, we've asked that they wear a mask. So if you're experiencing anything different right now in the homes, please let your case manager know or your supervisors because we want to keep you safe. And then we've got some new people. So Shanelli and Marquita started in November. So far we've got Paula, Courtney, Adriana, Charlotte, and Christine who started in December. So welcome everybody who's new to the company. We're very happy you're here. Updates on Kantime. So Kantime's our new EMR system. Many of you are on it. The system went live on November 1st and will be fully out of access by January 25th, but we'll be mostly out of it, almost completely out of it by January 7th. So we only have a couple of patients between the 7th and the 25th, but we will be fully out by the 25th. Right now, I was just reading an email from Marie, 80% of our patients have now shifted over from access to Kantime. If you haven't already taken training, done the Kantime training with Christine and Marie, they do it mostly by Zoom, but you can also come to the office and do it if you like. They have time scheduled every single week between now and mid-January. Please make sure you come in and get your training before your patient goes live. So on Kantime, we expect everything is electronic. So plans of care are now electronic. They're no longer Word documents. Mars and TARS are electronic, so you actually administer all of your medications and your treatments in Kantime and check them off as you go in the system. And any other kinds of logs, seizure logs or vent logs or whatever, all those logs are also part of Kantime. So we continue to need a lot of cooperation from you. So please make sure you get signed up for training. Make sure that you are doing your paperwork once you're in there. Make sure you find out quickly if you're having trouble, get your documentation done. Right now, it's really very challenging from a payroll perspective because we're running payroll out of 3 systems, our 2 access systems in Kantime. And so we really we need all the help we can get to make sure everything's running properly. And our case managers are working together with Marie, Kyle, and Libby to get all of the patients set up. Libby's really been doing a whole lot of that, a big bulk of entering all the new patients and getting their plan of cares, Mars, TARS, et cetera, in the system. And so it's, we just need everybody to do your best. And from what I can see, you've been great. Christine's telling me that the field team is just awesome and really working hard to learn the system, asking all kinds of good questions, and just being really just lovely to work with. So thank you. Elsevier, so we have a lot of Elsevier required training right now, and I thought I had a slide on the specifics of it, but maybe I missed it. So there are several different trainings right now that many of you are assigned to. So it's 3 months worth of training that we delivered out to you in October, and it needs to be done by the end of this month, by December 31st. So it has 3 parts to it, or I should say it has 3 hours worth of training in it. So you need to make sure you get in there as soon as you can and get those completed. We are still waiting for a Medicare survey. So perhaps in January they will come, our ACHC partners. Make sure you are wearing your badge, your PPE, make sure you have PPE supply in the house. Make sure you're practicing proper infection control, bag technique. Make sure that every house has a plan of care printed in the home. Make sure that you have your Mars and TARS, and patient education is being documented, and there's the go bag is ready to go. And certainly that if you go anywhere with a patient, that the go bag is with you and the patient, and that there are individualized emergency preparedness plans. We're also busy catching up on CPR. If you haven't done it, make sure you get it done. In-services need to be done. Performance appraisals, the other thing that's not in here, that's here is the annual competency evals, and you've been signing up the ones that are due, and that's great. So Medicare survey is coming soon. We're doing great, so hopefully that'll be easy. We have 2 drawings happening right now, so encouraging you to get, first of all, your in-services done. So everyone who is fully caught up on their in-services by January 4th will be entered into a drawing for a $200 bonus. So get your in-services done, and that'll be off your plate. It'll make you feel good, and you can move into in 2021 without anything on your in-services list. And you might win $200, which would be cool. We're also doing the same thing for competency evaluations. So complete your annual competency evaluation by January 15th, and you'll be entered into a drawing for $200. So this is for those who have competencies due now, due through January. So if you're one of those people, Taylor has already contacted you, and there were about 50 people initially, that 55, I think, who needed the evaluations, and we're about halfway through now. So we're continuing on. Jen Williams is giving those, and get it done by January 15th, and you might win $200. Holiday fun. So we had a fun ugly sweater day, and Kelly Noel was our ugly sweater winner. Ugliest sweater of all. She won a $50 Amazon gift card. Susan McAvoy also won a $50 gas card. And Libby won a $25 Dunkin' Donuts card. So lots of fun going on here in the office. And thank you all for those who did participate. So as a reminder, please take really good care of yourself. You know, water, take care of yourself, pray, meditate, take hot baths, you know, go for walks, pet your cat, just, you know, do things that are good for you. And just know that every day I'm waking up and I'm sending you love. I'm sending you gratitude, I'm sending you thanks. And I always love hearing from you. So never hesitate to reach out and say hello and tell me the good stuff. I love to know when things are good. And when things are troubling you, I love to know about that too. So that's all I got. If there's any questions, I'd be happy to take questions. I think most of you are on mute. So if you have a question, now would be a time to take yourself off mute. And if there aren't any questions, then I wish you a very, very merry holiday. And if I don't get to talk to you, then hopefully you'll have a wonderful New Year's as well. And we're ready for a new year, right? We're ready to make the page. All right, everybody, thanks so much. Go and make the world a better place.
Thanks, Coco.
Thank you. Thanks, everybody.
Thank you.
Thank you.